Sleep apnea is a really dangerous condition. It's basically, throughout the night, you're having these points where you're not actually taking in oxygen. And it's happening so many times throughout the night. And your body just gets used to it. And where it now, you don't even wake up when it happens. And that's what can lead to some serious, side effects. And the side effects are run the gambit. It could be as small as just, falling asleep at work. It could ultimately lead to death. And in between, there's organ failure. There's all sorts of conditions that are directly that come directly from sleep apnea. For sleep apnea, we do things just a little differently. We take the whole patient into consideration. And so when we work on a patient with sleep apnea, it's not just here's a device and get you breathing better. It's actually much more difficult than that. And it's really understanding what type of sleep apnea you have. Where are you on that spectrum? And then once we understand that, yes, we do give you a device to make you sleep better and sleep throughout the night, but also the follow-up that comes along with it. So it's not just here's a device and get better on your own. We're really here to make sure that we from A to Z taking care of you. And so there are two major devices to help with sleep apnea. So for severe patients, we would really highly encourage the patient to see a sleep specialist, and so they can get a CPAP. Right? But for patients that are mild to moderate, the research shows that the success rate for a sleep apnea device made by a dentist specifically is much more effective than a CPAP machine. See, a CPAP really doesn't work well with mild to moderate apneic patients because it keeps them awake, so the patients tend to not use them. Versus the device we make as dentists, they sleep throughout the night very well. Yeah, so the sleep apnea device we make for the patients brings the mandible forward just a little bit, and they sleep with that throughout the night. And what that does is it opens the airway, and we really want the patient to sleep breathing through their nose. And that's very important because the nose is a facilitator to make sure bacteria doesn't come to the back of the throat to cause inflammation. Also, there's some other advantages to breathing through the nose. So the sleep apnea device we make really focuses on opening the airway, but then also making sure you breathe through your nose. So as a patient, if you're not sleeping in the same bed as your partner because you're snoring, right? If you're falling asleep as you're driving to work the next day, if you see all these indicators of where you're just tired throughout the day, or you're not able to focus, or you can't lose weight, then you may have sleep apnea. And so I'd highly recommend coming and see us, getting evaluated for it. It's a free consult. Come in and we'll take a look, and we use our different devices to really figure out if this is something that we should pursue for you.